Okay. How does cocaine use affect the human body? By me, Carlos Arevalo. My outline for this presentation is the title, introduction, the effects part 1 and 2, help and solutions part 1 and 2, the conclusion, and my article and visual references. Introduction. Where did it originate? Benzolmethylcholine is a drug extracted from the Erythroelicsis coca leaves, and it can be broken down into three separate forms, which is salt, cocaine hydrochloride, and the one we were talking about more so is powdered cocaine. And how does this cocaine become a substance abuse? Well, the overuse of cocaine is called CUD, cocaine use disorder. It creates a strong desire to obtain and use cocaine. And that's because it is due to the cocaine being psychoactive and alters the brain chemistry, so you want it more and more and more, craving it like an addict, hence substance abuse. The effects of cocaine, part 1, is the lowering of gray matter in your brain as well as accelerated aging. So Professor Iman Beshiti, they conducted an experiment with 62-year-old males that have CUD and put them into the MRI and they subtracted the men's actual ages with the computing brain age prediction. And when they did that, they concluded that the mean age difference of the males is 2.62 years. And the analysis of the data also showed negative effects and changes within the gray matter part of the brain, specifically in regions like the anterior cingulate regions. The effects part 2. Oral consumption of cocaine. Cocaine attacks the heart and dopamine effects. So, for oral consequences, tissues within the mouth decay and can no longer refurbish. Your teeth begin to fall out, and the top of your mouth, the palate of your mouth, uh, begins to inflame and have lumps. Cocaine also attacks your heart by blocking sodium and potassium, which can lead to hypertension, cardiomyopathy, and many more nasty cardiovascular problems. And with all these problems, and blockages and the overwork of the heart, it could be fatal and cause death. And as for dopamine effects, an experiment was conducted that had two separate mice. One was given sugar, the other one was given cocaine, and it proved that even though both of them had dopamine, the mice that had the sugar declined to go back to it, while the one with cocaine kept wanting more and more and more and going back. And this further presenting the difference in reward functions between sugar and cocaine. Help and Solutions Part 1. Now, it depends on who you are on this side of the spectrum. So, for Part 1, if you are someone trying to help a cocaine addict, some tips I listed were, to educate yourself so you better understand what your loved one's experiencing. You should make a list of concerns and observations so you can refer it to them during conversations. Make sure you approach them quiet and safely so that you don't feel attacked. And while you do, make sure they're not, intoxicated in any way. They're not high, they're not drunk, nothing like that. And use a bunch of I terminology. You want to avoid calling them an addict or a junkie. You might want to say something like, "I am concerned about your cocaine use. You don't seem like yourself anymore," instead of "you're an addict and you need help." Always remain non-judgmental and compassionate. And if they are not willing to talk to you, return to the conversation at a later date. Help and Solutions Part 2. On the other side of the coin, if you yourself are trying to quit cocaine, keep in mind some withdrawal symptoms. The couple that I listed were negative moods, swings, a constant fatigue. Many people report having a lot of unpleasant dreams. I thought that was an interesting one. And as well as insomnia and hypersomnia. So, I myself have insomnia, so I can't imagine what it's like if you're a cocaine addict. And but anyways, ways of seeking help include: write down what you want to say in advance and help you stay on track. Talk to an addict treatment specialist or a trusted family member. Schedule an appointment with your physician to get evaluated. Ask your doctor for referrals and treatments, and using websites like findtreatment.gov. And the overall conclusion of this presentation is that the use of cocaine, CUD, harbors major negative and permanent damage to the brain and body. While the high may feel extraordinary as you touch Cloud 9 itself, the lows are irreversible damage to your body and mind. Seek help as fast as possible. The faster help is sought, the less damage will be brought. And these are my references. Thank you.